Animal Veterinary Care Center, Bilaspur, Chhattisgarh. And today we are going to live stream a cesarean section surgery in a cow. This is a stray cow, and let me share this link to the group and then we'll start the surgery. इसको ऐसे ऐसे ही रहेगा ठीक है. So hello everyone, we are going to start a cesarean section surgery in a cow. This is a stray cow, and the history from the rescuer says that she has been suffering from a labor pain since 5 or 6 hours now, and cannot able to deliver the calf, and so this is presented to us. In pet medics, we mainly treat small animals, but I do entertain surgery of large animals as well. So this is a stray cow suffering from dystocia, and we are going to perform a C-section surgery here. So my approach will be, I'll be giving an incision on ventrolateral oblique like this, and will enter inside the stomach, abdominal cavity. We will subside, push aside the omentum and the rumen, and then we'll lift up the uterus, and then we will take out the calf. I don't know, I have not palpated per-rectally whether the calf is live or not, but yes, let's see how thing goes. And we have given a local block, T block with lignocaine, and now we are performing a surgery. So we are doing we are first cutting. Oh, lignocaine लगा है कि नहीं लगा है? Oh, so we need to give some more lignocaine. More lignocaine, please. थोड़ा lignocaine और देना. We have to check local bleeding with the help of cautery. Give me the blade, please. We'll have to increase our incision. So I'm extending incision a little bit. The landmark should be that incision should go till the level of milk vein. So you can give a ventrolateral oblique incision, till extending till the milk vein. So now we are cutting through cavity, and we are inside the abdominal cavity now. संदीप अच्छे से तुम बना रहे हो ना वीडियो जूम करके. There it is. So this is a this is a stray cow, and she has eaten a lot of things like polythene and all, so the rumen is quite distended and gorged with a lot of rubbish material. So we need to put this, and this is So this is a uterus that I am lifting up, and it is here. This is a part of mesentery that has covered the uterus. So I am just trying to lift this uterus up. I'll ask my attendant to come from this side and lift this uterus up. तुम इधर से आ जाओ, इसको पकड़ो, ये यूट्रस को उठाओ ऊपर. थोड़ा सा और ऊपर उठाओ, बस. That's it. That's it. So now my attendant has lifted this. देख के फटे ना कहीं से. जूम कर रहे हो संदीप? हाँ, दिखना चाहिए. बस बस हो गया, हो गया. So this is a uterus that I am lifting up, and I'll cut through this area, go deep inside, and try to take out the fetus. So I'm giving a incision in the uterus now, like this, and I'll use my scissors to extend this incision, taking care that I should not cut any, थोड़ा आगे की तरफ लो उसको, intestine or something like that. Yeah. तो इधर से बनाओ ऐसे. So I'm giving this cut, and now I will take out the uterus, the fetus. So this is actually a breech presentation. You can see the legs. These are the hind legs, which is bent inside the stomach of a fetus. So this is probably a breech presentation. So what I'll do is I'll first take this legs out, and I'll ask my client to attendant to keep hold on uterus. तुम uterus पकड़ो, तुम पैर छोड़ दो, तुम uterus पकड़ो, uterus अंदर नहीं जाना चाहिए. So now I have taken out the uterus. इसको focus करना जब भी निकलेगा तो है, हो सकता है जिंदा होगा. And I am taking this scarf out. Yeah. And I think this is dead. So this calf is almost dead. I don't know from how long she is suffering from dystocia. कितने देर से इसका बच्चा फंसा हुआ था? कुछ मालूम है किसी को? 5-6 घंटे से. Okay. So this calf is dead, and without wasting much time, we'll forward to proceed closing of the uterus and positioning it. So इसको हटा लो जल्दी से. हाँ, जल्दी हटाओ. चलो. Okay. Yeah. Yes. So now this is a part of uterus with a lot of placenta inside. So we'll try to remove the placenta. And I'll put some antibiotic inside it. Lixin powder ले आओ. बस हो गया, ऐसे बोल के रखो। लिक्सन पाउडर ले आओ। नहीं। So what you're seeing is a uterus with this cotyledons, you can say, and while taking out the uterus, we have also damaged this wall, outer wall. So we'll be repairing this as well. Okay. So if you guys have any question, live chat is going on. You can ask me, and I can able to answer them as per my capacity. Can I have one artery forceps, please? गोपी, इसको थोड़ा सा जल्दी साफ करो। हटो भाई यहाँ से, हटो तुम लोग, इधर साफ करो जल्दी। So I am just waiting for some uterine medications to go, and we have just washed this with a warm water. Lixan लेके आओ जाओ। Yes. जल्दी लेके आओ लिक्सन पाउडर। जाके लेके आओ जाओ जल्दी। I'll start suturing it, and एक नंबर कैटगट दो, हटाओ। So normally they say in the books that the uterus should be closed in double layer of suture pattern, in which first layer should be Lambert's and second should be like Connell's or something. But in my practice, I adopt to do a 2-layer of suturing. First, I am doing a simple continuous lock stitch pattern, and the second will be Connell's or a Cushing. So that gives a good result. That saves a lot of time as well. So we'll be just closing this with a simple continuous lock stitch pattern. It is basically just to oppose the 2-layer of uterus together, and then the second layer would be inversion pattern that will invert the suture line, and it is such like the first suture line should get disappeared by the second suture. Regarding the anesthesia, I have given this cow xylazine and Sequel. Sequel is triflupromazine. It is outdated, but it still works very good. And I have given a local block of lignocaine. She was presented with a heavy bloat, tympani, you can say. So we have punctured the lumen wall just to take out gas, and so it's like first we are giving a continuous lock stitch pattern suture, and the second will be our inversion suture. Can I have another one number catgut, please? So my clinic is mainly of small animals, but I do entertain all surgical cases in large animals as well. This is located in Bilaspur, Chhattisgarh. Bilaspur is a small city in state Chhattisgarh. And my center name is Pet Medics Small Animal Veterinary Care Center. You can cut this. So we'll lock the first suture here, and we will continue so again it's like a simple continuous lock stitch. So here I'm not locking it in every step. I'm taking a one or two free throws and then locking it on a third or a fourth throw like this. This saves a lot of time, and believe me, I have done more than 200 of cesarean sections in a large animal so far in my 15 years of veterinary practice, and doing this type of suturing does not affect the healing of uterus or any sort of problems regarding conception will not occur if you use this kind of suture pattern. Okay, so we are about to close our first layer of suturing, and yes, so I'm giving a obedience knot, and I will continue to invert it and will give some Cushing sutures over here. So basically, we have to invert the uterus wall now such that the first line of suture get embedded in the second line. So it's like this. See, the first line is now getting embedded inside the second line. So it should be like this. While doing C-section, always try to remove all the placenta, as this can lead to post-operative infections. So I'm locking it here, and now I'll ask for another suture, one number catgut, please. That's very good. Oh. दिस वाला छोटा वाला ऊपर से ऊपर 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 से काटना चाहिए. So we are just continuing with our inversion pattern of suturing. There's a live chat going on. If you have any questions, you can ask them. I'll try to answer them. Is there any question coming up? कोई क्वेश्चन आ रहा है क्या उसमें चैट में? I've shared this link to few groups in WhatsApp, so people might be watching this as a live surgery. Otherwise, this video will be posted in the channel. So we have